Well, thank you very much. It's a pleasure to be here. I was not able to attend yesterday's session, so it may be some of the comments that I make may be a little bit redundant, but I just wanted to first tell you a little bit about the American Public Health Association, and we're the oldest and largest organization of public health professionals in the world. We've been around for 140 years, and we serve as an umbrella organization for public health professionals that represent primarily pretty much every sector of society. And with that, we work to protect the health of all Americans and from serious and preventable health threats. Also seek to ensure that there's access to universal services. And with that, the issue of age-related hearing loss is no different in terms of the issues that we have identified as very important. We know that the public health implications of age-related hearing loss go far beyond the immediate threat to the individual. Age-related hearing loss has been linked to things such as isolation, social isolation, depression, anxiety, which can lead to other public health and safety issues. And so they're very important that we try to address them at the primary level. And unfortunately, we know that Americans are seeking treatment and interventions at a time when it's too late, or usually when they're unable to communicate. And also that this is not just a U.S. issue, that we're seeing this issue worldwide. And so with that, we have several scientifically based policy statements that we have on our books, and these our policy statements are from which we not only guide our programmatic work, but our official stance on particular issues. And so specifically APHA, which I also think kind of ties into the collective actions that I think that we could take. And I'll just sort of talk about these, and I'm sure we'll come back to these during the discussion. We specifically advocate for early and cost-effective screening programs for at-risk populations, followed by careful evaluation and treatment, public education about conditions, warning signs, and the importance of seeking treatment. This is a perfect place for lay literature, and I'm sure those sort of things came up in the conversations. But also this awareness can lead to opportunities to employ preventive measures such as hearing protections. This is the opportunity to educate individuals about taking those precautions now. And I mean, even when we're thinking about not just these particular population, but younger populations, they are through these headphones and the other things that are they're exposing themselves to. These will continue to be issues, and so. These are things that we are constantly advocating for, not just for this population, but others. And then making, as a public health is a community-based approach, making use of the various settings that we can for reaching these populations. So not in addition to the primary care physician's office and acute care settings and nursing facilities, but also making use of places of worship, community-based programs, retirement communities, among others. We'd also say that, one of the things that we can continue to do is we have a broad advocacy platform to continue to promote the need for research to, address things such as whether or not where a particular stance on where we should begin screening for asymptomatic individuals, and just using, continuing to knowing that this affects a broad base of individuals, and using that to identify partners that can be involved in this process. And I'll stop there, and I'll come back as the conversation continues.